Welcome to Tuesday's edition of COVID-19. The World Health Organization believes about 10% of the global population may have been infected by COVID-19. Now, this frightening forecast comes amid a resurgence in cases in Europe and elsewhere around the world. We start the program now with the latest numbers on the pandemic here in Korea and across the globe with our Kwon So-ah and related news with our Kim Ji-yeon. So I hear the daily tally on the local front appears little changed.
Right, Sunny. Tuesday's tally stands at 75, which is 2 more compared to yesterday. But officials say it's the latter half of the week that really matters, and that will really tell us more whether people have been abiding by social distancing measures during the Chuseok holiday. Unfortunately, already a family transmission has been confirmed, which appears to have occurred during Chuseok. A woman in her 30s in Jeollabuk-do Province's city of Jeongeub has been confirmed with the virus, and after that, 7 other family members tested positive for the virus too. And that is why down here in Jeollabuk-do Province, we are seeing a rise in COVID-19 cases. The highest number of infections were again reported in Gyeonggi-do Province at 35, followed by 15 in Seoul and 4 in Incheon. Meanwhile, 66 cases this Tuesday were domestic infections, while the rest of the 9 cases were imported cases, with 5 of those detected at the nation's airport or seaports. Now, if we go over to today's figures now, with that, the total amount of cases stands at 24,239. The death toll remains at 422. More than 1,700 people remain in quarantine, while over 22,000 have made a full recovery of the condition. Now, if we go over to the developments over the past week, we are seeing quite an on-week jump from 38 to 75. However, relatively stable in the double digits, as we are seeing double digits for 6 straight days.
Right, so and I mentioned this at the start of the program, but the World Health Body believes that 1 in 10 may have been infected by the coronavirus, right?
Right, Sunny, that's what the WHO head of emergencies, Michael Ryan, said during a meeting, underlining that the vast majority of the world is still at risk. Let's take a listen to what he had to say.
Our current best estimates tell us that about 10% of the global population may have been infected by this virus. This varies depending on country, it varies from urban to rural, it varies between different groups.
So according to that estimate, some 760 million of the world's roughly 7.6 billion population may have the virus, and that would be far more than the tallies we are seeing every day, including by Worldometer. In fact, as of noon Korea time, the number stands at a little less than 35.7 million, with over 300,000 cases added in the span of 24 hours. The death toll stands at 1,045,942 again as of noon Korea time, with recovery standing at around 26.8 million. And now let's move over to the hotspots around the world, starting with the U.S. at around 7.6 million cases. Meanwhile, U.S. President Donald Trump reportedly returned to the White House, while his doctor says he's not out of the woods yet, though. India has now some 103,600 fatalities, and Brazil almost at 5 million total cases, and Spain is still seeing resurgences, meanwhile becoming the country with the 6th highest number of infections, surpassing Peru. And speaking of many countries still having difficulties in tracing figures, if we take a look at the UK with 515,000 cases, it looks like some 16,000 people who tested positive for the virus between September 25th and October 2nd were not recorded. Meanwhile, Italy's death toll has surpassed 36,000. And those are the figures I have for now, but I'll be back with more after the government briefing. Back to you, Sunny.
All right, so thank you for that. I'll see you back in a little bit. Back at the local front, a military base in Korea's northern city of Pocheon has been hit by a cluster outbreak, prompting the military there to impose stringent containment measures on service members and their families residing in the area. For more, defense correspondent Kim Ji-yeon is here in the studio with me. Hello, Ji-yeon.
Hello.
Right, let's start with this latest cluster infection in the military.
Sure. According to Seoul's defense ministry, some 36 enlisted soldiers and officers have tested positive for COVID-19. One of the 3 were first confirmed infected with the coronavirus last Sunday, and the rest were confirmed the following morning after members of the unit underwent testing for the virus. And the number of confirmed patients is expected to grow as test results are still pending for nearly 250 service members in the unit. So far, the military has reported 149 confirmed cases. More than 200 service members are in isolation according to the health authorities' guidelines, and more than 300 others are quarantined as precaution in accordance with the military's tougher guidance.
So, Chion, what measures have been put in place at the base then?
Well, currently the Defense Ministry has imposed a complete ban on off-base movement for all service members stationed in Pocheon, and all the personnel in the area have been placed in quarantine. All their family members in the area have also been placed in home quarantine, and their children are banned from attending in-person classes at schools.
Symptoms are being monitored among civilians who recently visited the unit, and those that have been in contact with the service members there are now in quarantine.
And to support those placed in quarantine, the ministry says it has dispatched a separate team to provide counseling, medical services, and distribution of food supplies.
That is good to know. Have authorities identified the cause of this current contagion, Chion?
Unfortunately, not yet. Authorities are still tracing the roots of infection in Pocheon, including instances of whether they were infected from those that have returned from vacation. 11 service members stationed there were found to have left base on vacation since late September, with one of the 3 infected officers found to have visited Seoul on September 26th and 27th. That's before the Chuseok holiday. But we're still waiting for authorities to release more details on this possible infection route. An emergency meeting of military staff were held virtually on Monday afternoon on this, which called for preventive measures in other bases. Defense Minister Seok has called for a strengthening of monitoring and social distancing guidelines and the wearing of face masks within the bases. The Defense Minister has also ordered the installation of heating equipment in quarantine facilities inside the bases in case another wave of the virus breaks out during the cold seasons of fall and winter.
I see. Now, Chion, I hear what's particularly worrying about this recent outbreak is that it occurred during the military's heightened social distancing measures, which were in effect at the time.
You're absolutely right. Eyebrows were raised over the recent cluster infection, which occurred despite a widespread ban imposed on off-base activities and leaves unless authorized by a commanding officers, leading to suspicions of a major loophole. The heightened measures were imposed during the special disease containment period right before the Chuseok holiday, which was to last until next Sunday, in line with the government's nationwide level 2 social distancing guidelines. Apart from restrictions on soldiers' vacation and leaves off base, visiting high-risk facilities such as bars, pubs, saunas, and internet cafes were banned, as well as social gatherings during off-duty hours were also banned under the measure. But recent data suggests commissioned officers in managerial positions may have engaged in activities that goes against these strict guidelines. According to data released by Representative Ha Tae-kyung of the People Power Party, 245 commissioned military officers have violated some of these preventive measures, with nearly half of them being caught attending social gatherings involving alcohol. A majority of the violators were found to have penalized lightly, such as suspension, suggesting that lax penalties could have led to such an aberration.
I see. All right, Chion, thank you for the coverage. Hope to see you again soon.
Me too.
Right, let's turn now to the regular government briefing on COVID-19 here in this part of the world. Now, daily infection numbers in the country remain in the double digits, but as emphasized time and time again, authorities remain on high alert as they point to the possibility, to the present status of the incubation period of the virus. Now, with Chuseok having ended this past Sunday, I hear that the briefing has started. I'll come back to you afterwards.
First of all, we have Mr. Kwon Junuk with the briefing. Let us now begin our regular briefing on the COVID-19 response here in South Korea for October 6th, Tuesday. As of today midnight, we have 66 new local infections, and the total caseload now stands at 24,239. 197 more people have been discharged, while 1,734 people are in quarantine. There are also 105 patients with severe or critical conditions, and we had no additional fatality. As of today noon, we have some updates on the domestic infections by region. Please note that these numbers are subject to change depending on the data accumulation time. First, in Seoul City, in relation to the North Seoul Dream Church, we have one additional case being confirmed. In total, 5 cases have been confirmed. In relation to Dana Hospital in Dobong-gu District, we have one additional case, and 47 is the total case load there. And moving on to Gyeonggi-do Province, in relation to a military garrison in the northern area, one more person have been confirmed, and a total of 37, all of which are servicemen, have been confirmed. And in relation to a meeting in Bucheon City, we also have 14 cases being confirmed to date. And moving on to Jeollabuk-do Province, in relation to a family gathering, we have the first index case being identified on the 5th of October, and 8 more cases have been confirmed with a total of 9 so far. In relation to the Green Koa public bath in Busan City, we have additional cases. A total of 11 have been confirmed to date. And as of today, we have 9 new imported cases, and 2 were from the Philippines and 2 were from the UK. As of now, we are also carrying out continued R&D on the therapeutics for the COVID-19. And as for the remdesivir, a total of 551 patients across 60 hospitals nationwide have been administered with the drug. As for the plasma therapy, we have also we are carrying out the second phase of the clinical trials, and in relation to the blood plasma donations, more than 2,000 people have pledged to donate their blood samples, and they have also donated their samples as well so far. And in relation to the antibody testings, the antibody is the clade 4 and G type, and we have confirmed that this can also protect and immunize people from the G type virus as well. And in relation to the life quarantine measures, as we are also witnessing chilly weather, we believe that many people could also head to hiking to the mountains, and we also have an related case that has been reported at our safety e-report. And in relation to an hiking meeting, people did not wear face masks when they were inside a cable car at these mountain areas, and they were also closely located from each other, and also they did not wear face masks when they were working outside as well. And in order to guarantee and ensure safe environment while hiking, please minimize the number of attendees, and please also go on individual hiking as well, or with small limited numbers. And even when you are outdoors, when you cannot keep a 2 meter of healthy distance with others, please wear your face masks at all times. And if it is very difficult to breathe when you are climbing up the mountain, please guarantee your enough space in between yourself and others, and to enjoy some fresh air. And when you are enjoying food, please minimize a dialogue as well, and please eat with your own servings as well. Last but not least, we have further messages for the public. After mid-August and until the Chuseok holidays, we have also witnessed that many of our public members have been exerted their full efforts to participate in the social distancing measures. And thanks to your all efforts, we were able to contain the virus to a large extent. And this shows that the importance importance and highlights the importance of the group and collective efforts of the public as well. And I would like to also thank the members of the public for their efforts. And if we can continue such a curb on the virus so far during the next week, we believe that we can also have new trials in combating the virus. For instance, we can also ease and relax our intensify social distancing measures, and we can also have an opportunity to seek new ways of keeping healthy social distancing at specific venues. And please note that the COVID-19 and other infectious diseases have also brought about new normals for the global community. And also this would prevent and this has also prevent the world population from spitting or littering on the streets, and this were also practiced only 130 years ago. And probably in the near future, we will also see wearing of face masks and social distancing, which are the core quarantine measures for COVID-19, could be a new normal for our daily lives in the near future. Maybe this would be something that is unavoidable and an essential path that we must take. COVID-19 is threatening us in diverse ways. However, if we keep social distancing, we can contain the virus. And until we have an effective and safe vaccine, which also can put an end to the pandemic, until then, we need to carry out and practice individual hygiene measures, including wearing a face mask, washing of your hands, as well as keeping healthy distance. And we can overcome the virus with such collective efforts. This week would also show the changes of the COVID-19 outbreak depending on the traffic, the movement of the people during the Chuseok holidays as well. It could lead to a nationwide outbreak, and this is why wearing a face mask and social distancing is ever more important now. And as we saw in the case of the military garrison in the northern Gyeonggi-do area, if we have close contact with people and if people are remaining in crowded situations, we can also be exposed to the COVID-19 virus. There is no venue that is safe from the virus. And until this week ends, the government will also closely monitor the situation, and we will also carry out tracing and testings as well. So we ask the individual members of the public to monitor your own health conditions, and if you have suspected symptoms, please refrain from going to work or going outside, and go to the clinic centers to get tested as soon as possible. And please call your parents who are at hometowns to check their health conditions as well. Thank you very much.
Right, there was Kwon Jun-wook, Deputy Director General of the Central Disease Control Headquarters, with Tuesday's afternoon briefing. So, what was the gist of his address today?
Well, since we are just a few days past the 5-day Chuseok holiday, he has stressed how people should remain vigilant, although he has also been acknowledging the nation's people's efforts in social distancing, abiding by social distancing measures, which is why we are maintaining the figures currently in relatively stable conditions. But there are still numerous new cluster infections. We also talked about the Pocheon military unit before with Cheon, and also it looks like 9 cases in total are related to a family in Jeongup in Jeollabuk-do province. So it is still important to stay away from other people, even if you are relative with these people. And he also mentioned concerns due to the nice autumn weather that may lead to a rise in outdoor activities, including hiking. And there are some cases where people have not been wearing masks on the cable cars, for instance, and also when they're using sports equipment, they should be careful as well. In the meantime, he also mentioned that people should monitor their own health conditions, especially this week after the Chuseok holiday, to see whether they are developing any COVID-19-like symptoms.
I see. All right. So thank you for that. I'll see you again tomorrow.
See you tomorrow.
Right, in less than a year since it was first reported in China, COVID-19 has taken more than 1 million lives, and according to the World Health Body, the pandemic could kill 1 million more in the coming months. Given this grim scenario, pundits worldwide are underscoring the need for greater global collaboration in the fight against the virus. Do take a look.
Nearly 10 months after the first index case of COVID-19 was reported in Wuhan, China, the novel coronavirus has left a path of destruction on all corners of the globe. In response, the World Health Organization has spearheaded a united response to the pandemic in conjunction with a number of international bodies, including the World Bank. Dr. Jim Yong Kim, a Korean-American physician who served as the president of the World Bank for 7 years, underscored the important role that the WHO must play to foster international cooperation in healthcare.
We need to support them and give them the kind of financing, give them the kind of mandate that they need to operate. I don't think it's going to get better if we recreate it. It's not a structural issue. It's the governments embracing these systems and being willing to give up some of their own selfish concerns for the good of the world.
Dr. Kim says the world must support debt relief for poorer countries in order to prevent a sovereign crisis amid the COVID-19 recession.
Maybe a decade plus ago, and the so-called HIPC, the Highly Indebted Poor Country Initiative. And it was done with the promise that this is one time and we're never going to do it again. At the very least, delaying debt payment, but also I think debt relief is going to be something that's going to be really important to allow the countries to have enough resources to build out their healthcare systems.
A united global front against COVID-19 is especially important for countries with poor healthcare and disease management systems. Korea has launched an initiative to bolster aid and support disease containment efforts in developing countries.
한국은 국제백신연구소의 본부가 있는 나라로서 개도국을 위한 저렴한 백신 개발, 보급 활동을 적극 지원할 것입니다.
The COVID-19 pandemic has also triggered a tectonic shift in the global balance of power. Professor Stephen Walt from the Harvard Kennedy School had this to say.
I wouldn't say Asia is ahead of Europe or the United States, but the balance has been shifting back there. In general, Asia has handled this better than some countries in the West. South Korea did very well, I think, relatively effectively. And that's, I think, going to have a long-term impact first on how rapidly they can recover economically, but also on the overall image that they'll have in the world. The idea that countries will sort of trust the competence of the government because they handled an emergency very well.
Professor Walt underscored the growing importance of close cooperation, especially in the world's academic arena, in adapting to these wave of changes.
So if a scientist in South Korea or Japan or England or the United States or China comes up with an important discovery, new knowledge about how the virus works, how it might be defeated, the more broadly that is shared and the more rapidly that's shared, the more likely we are as a species to come up with an answer for it.
The world must come together and unite if we are to quickly find solutions to the ever-worsening COVID-19 pandemic.
Over in Saudi Arabia, pilgrims are heading back to Islam's holiest site in Mecca. Authorities there have resumed Umrah services, which had been suspended back in March amid the pandemic. For more on the gradual ease in COVID-19 restrictions there, I have Hussam Al-Mayman live on the line. Hello, Hussam.
Hi, Sunny. How you doing?
Fine, thank you, Hussam. Now, please do start by telling us a bit about the Umrah pilgrimage, which I understand resumed this past Sunday, Hussam.
Okay, so Umrah, just like Hajj, is a Islamic ritual where it's year-long, and it's as opposed to Hajj where it's seasonal. and you are required to do Hajj once in your lifetime as a Muslim, and Umrah can be done, as many times as you want. Now, the difficulty with the pandemic has caused a great halt on that. So, as a country that hosts Muslims from around the world to perform their Islamic ritual, it's been kind of a sad year for Muslims who wanted to come to Saudi Arabia and visit the holy sites.
I see. Hussam, I hear the Umrah services are being resumed in phases to ensure safety. Please tell us more about the phased openings and about the other measures in place to prevent an outbreak there.
Okay, well, the Ministry of Hajj and Umrah, along with the competent governmental bodies who execute these services on a yearly basis, 24 hours a day, 7 days a week, all year long, have been in constant, of course, communication, and which has been the pivotal part for the kingdom's success in handling the pandemic. So it's a matter of managing, people's movements and also monitoring them to ensure that their health is fine and they don't show symptoms of the COVID-19 disease. There's the announcement has been made that there's 50 buses to help move 200 pilgrims who are going to have access to perform this ritual for 3 hours. So I think it's a logistical matter that just manages the flow of movement going in and out of these holy sites to perform this Islamic ritual.
Is the Umrah open to foreigners, for example, those Muslims outside of Saudi Arabia?
Well, that goes past what's that has a lot to do with the travel accommodations and the travel preparations. Now they announced that there is international travel will resume in the kingdom within January. Of course, international travel has commenced, but with certain guidelines in certain cases that are allowed to travel in and out of the kingdom. So I do believe that in a matter of time, when things are moving towards the pace and the precautionary measures are at a level where everyone's comfortable, then yes, I do believe that the kingdom will be open again as planned and as before the corona pandemic.
Right. Hussam, how is the COVID-19 situation in Saudi Arabia? Correct me if I'm wrong, but I am aware that this past Sunday when Umrah resumed, the country recorded its lowest daily tally in 7 months with 390 infections only.
I'll take your word for the numbers, but I've been covering COVID-19 since the heart of the pandemic was at its highest level in March, and I've spoken to lots of governmental authorities that are within the Saudi authorities and also international bodies as well. So what was paramount to the kingdom's success is the governmental coordination between the governmental bodies. So I think that was a key indicator to the success, and also a pivotal role was the royal decree issued that anyone in the Kingdom of Saudi Arabia is to get treatment for COVID-19 should they need it, whether you're an expat, whether you're a national, whether you're in the kingdom legally, illegally, whether you're there visiting and you've just managed to get stuck. So that was a very paramount indicator for the kingdom managing the pandemic, I think.
I see. Hussam, now come November, Saudi Arabia will host professional golf tournaments for women for the first time. Tell us more about this and about the public response to this upcoming event.
Well, I'm kind of very excited, actually, that we're going to have this tournament here in the Kingdom of Saudi Arabia. We've actually had lots of world-class events. So we've had 2 Formula E competitions here. We've had a world boxing events. We've had wrestling. So this is just another one of the world-class events making its way to the Kingdom of Saudi Arabia. I understand the Aramco KSA Ladies prize will be $1 million US, and the Saudi Ladies Team International will be $500,000, where 36 teams of 4 will be competing for the winning prize.
Will you be covering the event?
Well, I don't mind covering it or visiting it. I mean, I actually like to visit. I like to attend these events as much as possible. I mean, it's always nice to see world-class events making it here to the Kingdom of Saudi Arabia, and it's also nice to experience history as it happens.
Right. All right, Hussam, thank you very much for making the time to be with us live at this hour.
Thank you, Sunny.
전에처럼 이래 뭐 활발한 기분 그런 게 없어요. 전부 다 걱정.
지금 소통적인 문제도 그런데 사실상은 지금 상황이 좀 많이 답답하니까.
We started the year with news of COVID-19, and it appears that we might end the year with the same story. And no doubt, this prolonged affair is affecting both our psychological and physical well-being. Now, for more on this, I have Director Kim Moon-gyu of the ODA Center at the Yonsei Institute for Global Health joining me live on the line. Good to see you again, Director Kim.
Nice to meet you again.
And also, with social distancing in mind, I have Professor Chung Sun-jae from Yonsei University also with me virtually. Hello again, Professor Chung.
Thank you for having me again.
Director Kim, we'll start with you. Daily infections for today and yesterday, the first 2 days following the Chuseok holiday, have been hovering in the 70s. Now, data also show that there was a tangible decline in the number of cars on highways and people on trains and buses heading home. What is your current assessment of the COVID-19 situation here in the country, Director Kim?
Yes, WHO thinks that Korea is having a cluster outbreak, and we had the first one because of Daegu, and during the August we had the second cluster, and it's going on still, but I think it's will get less and less, but still we have a few more days to watch on the impact of Chuseok, because a lot of people gathering and moving. So I'm optimistic, but still we need more days to cover.
Right. Professor Chung, COVID-19 has given way to a list of new jargon, including the common phrase coronavirus blues, to describe the sense of despair and dread driven by the prolonged pandemic. Has there been an actual shift in people's psychological health amid the raging pandemic, Professor?
Yes, absolutely. In fact, according to the result of our own study, which were conducted for more than 3 times, there were different patterns of mental health issues in our population by time. So in the early stage of COVID-19, people with acute anxiety were greater than those with depression or PTSD symptoms. And actually, in the presence of sudden threats such as influx of COVID-19 into Korea, people become more irritable and agitated at the first place. These phenomena were particularly seen in well-educated and upper-middle income classes, and there were no gender differences. Interestingly, as time goes by, the frequency of reporting core symptom of major depression, which is characterized by loss of interest in life and hopelessness, surpassed the anxiety symptom after 6 months from the initiation of the outbreak. Although we are currently in analysis, it seems that more than 60% of people is now facing chronic mental health problems, including depression and PTSD, in this September.
That's quite a frightening number. I'll get back to you for more on that, of course. But first, Director Kim, during Monday's afternoon briefing on COVID-19, authorities here spoke of 2 cases of multi-system inflammatory syndrome in children. Could you tell us more about this disorder? I understand it's a rare disorder among the younger patients of COVID-19.
Yes. I think this COVID-19 virus is very pro-inflammatory, and I think that's the reason we sometimes see this multi-system inflammatory syndrome. By definition, it's defined by the age less than 21, and we must have the evidence of inflammation and at least more than 2 organs involved without any other cause of the symptoms. And finally, it must be COVID-19 positive within 4 weeks. And the symptom is very similar to Kawasaki disease, which is common for Koreans and Japanese. But I think it's more like macrophage activation syndrome. So we have fever, rashes, conjunctivitis, and mucosal changes. And sometimes we even have some rare symptoms like thrombosis and etc. So some people say this is a fatal, but I think until now we have the data showing that it's not a fatal disease if treated properly. And we treat this disease by giving intravenous IV globulin. Sometimes we add on steroids, just like President Trump had. And if there's any evidence of thrombosis, we have to add low-dose aspirin. So that's the picture of multi-system inflammatory syndrome by COVID-19. And it's still too early to say fully about this disease. So this is how we treat until now. And most of the cases do not have this problem. So we have to keep watch on this.
I see. Professor Chung, going back to the coronavirus blues, is there a way to tell if we are suffering from clinical depression and are in need of professional help, Professor?
Yes, basically, depression is associated with a larger proportion of suicide, and the core symptom is the loss of interest in daily life, which we call anhedonia, and the depressive mood or feeling of hopelessness, which lasts for more than 2 weeks continuously. In addition, other symptoms include difficulty in sleeping or sleeping too much or having extreme fatigue or too poor or too much appetite existing or thinking of yourself as a failure, having difficulty concentrating on work or moving too much agitated or moving too slowly and thinking of suicide, which also lasts more than 2 weeks. So if these symptoms continue, please seek for the psychiatric help. However, one thing I want to mention is that even though people think that financial difficulties from COVID-19 is the main problem, and what we should note is that proportion of young women is very high among these suicides in COVID-19 era. And if the recession from the COVID-19 is a direct problem, the target should be like men in their 40s or 50s who are actually self-employed. In fact, even before COVID-19, young women and the elderly population accounted for a high percentage of Korea's suicide rate. And I think the problem of social unequal structure interacts synergistically with this epidemic and hits the most vulnerable population nationwide. So in this case, I am worried that just perceiving the mental health problem individually would not make better solution. Instead, overall social change and care for these people is needed.
I see. That's quite unfortunate. Professor Chung, a study in the US claims the psychological impact of COVID-19 is likely to stay with us for many years to come, even in the presence of a vaccine. Can you explain this rather grim outlook for us?
Yes, well, in fact, a very close example would be a study conducted in MERS outbreak in Korea. The study reported people who suffered from MERS outbreak at 2015, and they had much higher frequency of PTSD symptoms after 3 years later than the actual outbreak time point. In fact, there are studies showing that when a crisis strikes, the suicide rate of people decreases or stagnates at the beginning. However, symptoms of depression, anxiety, and PTSD followed by higher suicide attempts increase after a few months later. In addition, there are studies which demonstrated the longer exposure to trauma is associated with the higher frequency of PTSD and depression. So regardless of COVID-19 situation, this phenomenon may be provoked by simple threats from COVID-19's biological aspect, but it can include a longer process of broken social activities and hardship of adaptation. So to overcome this, we need to maintain social network or communicate with other people, which will lead to social support, act as a source of psychological resilience to reduce these adverse mental health outcomes.
I see. Director Kim, there has been one case of reinfection here in Korea and some 700 cases of retesting positive for the virus. Could you explain the difference between these two conditions for us? And why is making such a discrepancy important between reinfection and retesting positive? Director Kim.
Okay. When we say retesting positive, we have to distinguish whether this is a reinfection or a recurrence. Recurrence means the virus is still in your body and it is causing a disease again. And reinfection means that you recovered and you get another strain of a new COVID-19. And there are some pitfalls that we have to care. We are testing the virus by PCR, which means it's not a living virus. So sometimes, even though you might have positive, that doesn't necessarily mean that you are reinfected. So usually the coronavirus has a strain-specific immunity, which means if there's a different strain in the population, you might catch another coronavirus, and this immunity lasts for about a year. And we don't know exactly what's going to happen for COVID-19. There are a few cases reported until now for reinfection, and there's one case in Hong Kong, another case in Korea, and there's another one in Nevada. It's too early to say and make conclusion, but usually the reinfection has a mild, and that's a good sign for the scholars who are trying to develop a vaccine, because even though you get a infection, the immunity might work, and that's a good sign for vaccine development. And previously, I told you that COVID-19 sometimes come with the multi-system inflammatory syndrome, and it's caused by our own immunity, and which many cytokines are excreted. And there's something we have to consider, that this reinfection might sometimes result in severe cases, rarely. So you don't have to worry every time that it's positive. The most important thing is the symptom. And if the symptom is mild, it's too early to worry about it. So yeah, we have to see for more cases to accumulate.
I see. And speaking about treatment, Professor Chung, do you believe that patients of COVID-19 should seek psychological therapy with the physical treatment to ensure a healthy recovery, Professor Chung?
Of course, once confirmed, people suffer from tremendous psychological distress in terms of disease with uncertain outcome, and also suffer from stigma and trauma, such being criticized by people around, and as a source of spreading the virus. So anxiety and trauma that comes from the disease treatment experience continue to be internally imprinted. And if a similar situation occurs later, there is a chance that this experience might frustrate and might be frustrated or can be easily recalled. So such experiences can lead to depression, PTSD, suicide, and many other mental health problems. So for these confirmed patients and those who have completed treatment, mental health monitoring is required continuously after the treatment, and a hotline for their emergent mental health care needs should be provided.
I see. Director Kim, what can authorities do to better protect the public's mental health amid this raging pandemic?
Well, there's a word called long COVID. I mean, even though you recover from the first infection, the symptoms continue for quite a long time. So most frequent symptom is chronic fatigue, and doctors think that is similar to chronic fatigue syndrome. And it might have some psychological symptoms like depression, anxiety, hard to think clearly. And I wish that the government will monitor the recovered patients from COVID-19, and we have to know the impact of these chronic problems. And if we know that phenomenon, we can deal with that in a very early stage, and I think we'll have a better result from COVID-19.
I I see. Very briefly speaking, I extend the same question to you, Professor Chung. What can the government do to better protect our mental health?
I think the government should have like two targets. Like for the most of all, like the common people, the government should encourage the people and have maintain their social network and stay as a whole one community. And for the people who are vulnerable, they should make the targeted approach to monitor and care about their urgent needs in the system.
I see. All right, Professor Chung and Director Kim, as always, thank you for your thoughts.
Thank you.
Thank you very much.
Right, and on that note, we end this edition of COVID-19. Be sure to join us again tomorrow at this hour as we delve into two distinct social phenomena created by the pandemic. Do take care and see you on Wednesday.